Hello, my dear friends. This is Dr. Charles from PatientCareLinks, where we share practical health lessons drawn from real cases we see every day. Behind many cases of itchy palms, redness, blistering, peeling skin, burning sensations, swelling, and cracked hands that people often dismiss as just dry skin, there is sometimes a much deeper process quietly unfolding within the body, a process that affects the skin, the immune system, and the protective barrier of the hands. And today, I want us to explore a condition that is becoming increasingly common: allergic contact dermatitis of the palms. The itchy hands, the burning palms, the painful cracks, and the tiny blisters. This discomfort makes even simple daily activities difficult. At first, many people dismiss these symptoms. They think maybe my hands are just dry, maybe it's the weather, or it will clear on its own. For a while, everything appears manageable. People continue cooking, cleaning, and handling detergents, soaps, chemicals, or gloves. But allergic reactions often begin quietly and progressively. Underneath, the skin may already be reacting to something it comes into contact with repeatedly. Because not every skin rash is caused by infection. Sometimes, the body's own immune system is reacting to an everyday substance. That is where the real story begins. Allergies often develop after repeated exposure. A person may use the same soap for months or wear the same gloves without any immediate problem. They handle the same detergents or cosmetic products daily. Then, one day, the skin begins reacting. The earliest signs may seem harmless, a little itching, or mild redness. It starts with nothing alarming. But underneath, the immune system continues responding. The skin barrier becomes damaged and inflammation increases. The itching worsens. Tiny blisters appear. Painful cracks develop and the palms become swollen. What appeared to be just dry hands reveals a deeper condition. The body is not sending random signals. It is revealing an allergic pattern. Now let's step back and look deeper at your skin's role. Your skin acts as a protective barrier against bacteria, chemicals, and irritants. Under healthy conditions, this barrier remains strong and efficient. But when an allergen touches the skin repeatedly, the immune system recognizes it as a threat. This starts a biological domino effect. Inflammatory chemicals are released. The skin becomes red, itching develops, and the barrier weakens. Scratching causes even further damage. Bacteria may enter through the broken skin. What started as a mild allergy gradually becomes a painful systemic skin condition. From a doctor's perspective, common triggers include soaps, detergents, rubber gloves, hair dyes, cosmetics, and certain metals like nickel. Doctors diagnose this by taking a careful history and performing patch testing to identify the specific allergen causing the reaction. Nurses teach patients how to protect their hands while they heal. Simple measures like avoiding harsh detergents and wearing protective gloves make a big difference. Pharmacists help you understand how to use prescribed creams correctly. Identifying the trigger is just as important as treating the rash itself. Dietitians emphasize that healthy skin depends on nutrition. Vitamins A, C, and E, plus zinc and healthy fats, support the skin's repair process. The encouraging reality is this: once the trigger is identified and avoided, most allergic reactions improve. Recognition early can prevent long-term damage. Protect your hands and pay attention to your skin's patterns. Seek medical advice if symptoms return. Protect your skin wisely. Patient Care Links is here for you.